So I'm Krista Priest. I work in the emergency department at the Launceston General Hospital, so public health is my sector. I think I became a member of HACSU very shortly after I started at the Launceston General Hospital because I was a hairdresser prior to that, and we didn't really have any union strength in an industry that is as old as brothels, and they seem to have gotten paid better than most hairdressers. So I really understand the value of a union and women's rights in the workplace. One of the things that I've learnt in this conference is that we all are experiencing the same amount of hardship in the workplace, and also I like the recognition that frontline workers are the everyday workers. There is no frontline worker, it is just everybody that's working hard.
I'm Tony Priest. I work for Disability Services. Working with clients, it's a passion. Just a simple thing like chopping an onion, giving them the skills to chop up an onion. The look on their face when they've done it, they're happy. Yeah, it's rewarding.
My name's Peter Moore. I work in the community service for the district nurses. Anywhere from showers, housework, shopping, respite. Change needs to happen, but I look for more on the client side than I do for a company. And I've always said if a company looks after its workers, the workers will look after the company.
Rita Gravenhoff in disabilities, 24 years, and then became a delegate 3 and a bit years ago. Getting an outcome for one of my colleagues who was ignored by our employer, and now we've got a great outcome. Well, solidarity means working together. You make friends, and friends help friends, like family.
David McNamara, aged care and public health. I've always been a member of a union. Employees aren't out to protect you. They're out for themselves. And it's important that as employees that you come together.
My name is Tanya Smith. I am with Multicap, so I'm in Disability Services. I have found the union has been so supportive, and if I've been unsure about something, I've been able to jump on, ring up HACSU Assist, and they've been able to give me information very, very quickly. And if they haven't had the information, they have come back to me within a very short period of time.
I'm Jason, I'm a hospital aide in ICU. I've been hospital aide for 12 years and I've worked 15 years at the LGH. Co-workers said I'm a good communicator and I'm not frightened to speak my mind or defend people who can't. So they said you'd be a good choice to be a delegate, because you'll get our views through to management because they don't listen to them as individuals. So I took that on.
My name is Tanya Walker and I work in aged care. I love taking care of the residents and seeing them happy and working on their goals. I started out in disability and that's because I have disabilities in my stepchildren. That made me want to start disability because I wanted to see how disabilities work. One of the highlights as a delegate is when I went to speak in Canberra with Bill Shorten about the NDIS. I have seen firsthand where some of the systems were being rotted. I wanted to make a change and he actually took it on board.
Kerry Langton, disability support worker. HACSU member for the last probably 2 years, maybe 3. I've only been a delegate for the last few months, so this is obviously my first conference. I've been challenged by lots of the things that have been presented because I actually come from a background where I was an employer and I wasn't really all that supportive of unions. I thought when I became an employee that I would be covered under the umbrella of the employer. But I've seen in the workplace instances where fellow workers have, this might be a bit of a crude way of putting it, but the employers just tried to find a way to roll them under a bus when there's things that have happened that were beyond their control, or I believe they were beyond their control. And I suddenly became aware that it was important that I join a union for a start. part of the reason I took on the role as a delegate is because I'm lucky enough to be in a position where I hope I might have a few more years left to go, but I'm not a 30-year-old with a huge mortgage, and so therefore I'm willing to stand out and be counted a little bit and speak up. They're very glad that a loud-mouthed arsehole like me is willing to stand up and be counted.
Yesterday it was really good when Cecily Rosol and Ella Haddad were here, that someone stood up and said that they really would like the ministers to come and speak to the individuals and not hear the voices through management as such, because the voices of the people actually at the coalface are the ones that are experiencing all the hardship.
Get your fingers out of the backside and fix it. Ask. If they don't know how to fix it, ask people that are in the sector. Get ideas from them. It's just simple as that.
So politicians talk to the right people, and they are not the CEO and the board members. Get off your bum, walk around, walk into wards and go and say, right, I'm going to talk to 6 cleaners today, 4 hospital aides, 3 kitchen staff.
I think it's important that they listen to people at all levels, whether it be senior management or whether it be down at the delegate level, because we've all got a part to contribute to what's going on and what needs fixing.
Get off your ass and fix our health system. Yes, I'm a sportsman. Yes, I'd like a stadium. But I'd like our health system fixed first before we worry about other things.